Welcome to our virtual joint school presentation and the Captain Sir Tom Moore building, previously known as the Cheshire and Merseyside Treatment Centre. The purpose of the presentation is to prepare you for surgery to ensure you achieve the best possible outcome from your surgery. The team is made up of different professionals and are here to support you, so please make a note of any questions that are specific to your own circumstances, as along with this presentation you will have a one-to-one phone call where we can discuss this further. We would encourage you to ask a family member or carer to watch this presentation with you. It is essential that you watch this in order to proceed with having your joint replacement. We have posted out a booklet which has a further explanation of some of the points, so do please also refer to this once you have finished this video.
Before we start, let's recap on what a hip joint looks like and how a total hip replacement might help to relieve your pain and discomfort. The hip is one of the body's largest weight-bearing joints. It is a ball and socket joint, which is a type of joint that can move in many different directions. The socket is called the acetabulum, and the ball is the femoral head, which sits at the top of the thigh bone. The surface of the hip joint are covered with cartilage, a smooth tissue that cushions the end of the bones and enables them to move smoothly. You are likely to be considering a total hip replacement as you have been experiencing hip pain which has started to affect all aspects of your life, from activities of daily living, work, relationships and psychological well-being. These have probably led to a decreased quality of life. You might have considered and tried alternatives to surgery such as weight loss, exercise, hip injections or adapting how you do things, but these have not led to a significant decrease in your pain levels. If you want to discuss alternatives to surgery, please speak with your consultant. Whether you decide to have the operation or not, there are some recommendations you can follow to improve overall good health. We advise you to stop smoking and cut down on alcohol. Intake of a balanced diet and regular gentle exercise within limits of your pain are advised. Following this advice will also help to recover quicker in the post-operative period. If you need further support or advice on stopping smoking or reducing your alcohol intake, please discuss with your GP. Due to the nature of total hip replacement surgery, there are certain restrictions which will have an impact on your daily life in the immediate post-operative period. Once you have had a total hip replacement, you will need to avoid 3 movements for a minimum of 6 weeks. These 3 movements are: do not bend beyond 90 degrees at your new hip. This means you should not bend to let your hands go past your knees or lift your operated leg towards your body. Do not twist at your new hip. Keep your nose in line with your toes at all times. And do not cross your legs or your feet. These restrictions are called hip precautions. When you come into hospital for your operation, we will expect you to recall these 3 precautions from memory. Within the first 6 weeks of having your surgery, you are at higher risk of hip dislocation. This is why it is important to follow the precautions. Failing to follow these can cause readmission into hospital, thus increasing risk of exposure to hospital-based infections. It interferes with the healing of the soft tissue around the hip joint and could lead to hip instability. The national average of this happening is 2%. That is why we are educating you on these precautions before the operation, so you have as much time as possible to prepare your home and yourself. These include avoiding movements with force or in combination, or bending your hip excessively. An example of this would be squatting to the floor. When sitting on your chair, toilet, or on the edge of your bed, the golden rule is that your hips should be higher than your knees. Your thighs should slope down away from you. We have sent you a form in the post asking for you to measure the height of your furniture. It is essential to complete this before your one-to-one phone call appointment. If the furniture is unsuitable to be raised, you will need to make sure you have purchased or hired an alternative before your operation. If you have an armchair that slopes down or is soft, you may need to level up the seat. Try putting a folded blanket under the cushion, towards the back of the seat. You are aiming to sit with your hips higher than your knees. Avoid swivel chairs or computer-style chairs as they put you at risk of twisting or could go away from behind you. Arrange furniture to avoid twisting or bending. Think about your coffee table, telephone, lamp, or toilet roll. Initially, you may need help with some activities at home, for example, cleaning and shopping. A total hip replacement is major surgery and a big life event. It is important to acknowledge that following surgery, you might feel low in mood or anxious. This might be because you are worried about how you will cope at home, or you already live with a mental health diagnosis which you worry might get worse after the surgery. Think about who you can call. It may help to speak about your worries with friends and family, participating in activities you enjoy or practicing mindfulness. If you are particularly worried, please speak with your GP, consultant or occupational therapist.
On entering the building, you will have a COVID symptom and temperature check. Please ask your lift to wait until this check is completed. You'll be provided with a mask, and you will also notice that all staff are wearing masks as well. You will then be directed to your bed space on the ward, which is on the first floor. The nursing staff will introduce themselves and complete your admission paperwork. This is to check that nothing has changed since you have had your preoperative assessment and help complete the necessary risk assessments. Your blood pressure, pulse, temperature, respirations and oxygen saturation levels will be checked and recorded and the theatre checklist completed. A patient identification band will be placed onto your wrist, and if you have any known allergies, this will be red in colour. Your legs will be measured for stockings if these are indicated to reduce the risk of clots forming in your legs. When theatre are ready for you, you will be taken straight into theatre and assisted onto the theatre table, and this is where your anaesthetic begins. There are no anaesthetic rooms in this building. Once your surgery is finished, you will go into the recovery area, and when you have recovered sufficiently, you will be collected by the ward nurse. You may find that you have a urinary catheter inserted in theatre, especially if you have had a spinal anaesthetic. You will also have an oxygen mask or nasal oxygen and an intravenous drip. You will be offered a drink and something to eat as soon as you arrive on the ward. If you have a general anaesthetic, you may not feel able for a couple of hours. The nurse will check your blood pressure, pulse, respirations and oxygen saturations hourly for the first 12 hours. The physiotherapist will assess you soon after your return. The aim is for you to stand mobilise as soon as possible and when it's safe to do so. This may be on the day of your surgery. You will be given your medications as usual, and blood thinning medication, either an injection or aspirin, will be given as per the NICE guidelines. Your dressing will be checked and changed if required. The nurse will assist you with your hygiene needs, and you will be monitored closely by the following team: nursing staff, occupational therapists, physiotherapists and medical staff. The team meet daily to discuss your progress, and when all members of the team are in agreement that you are medically and therapy fit, you will be discharged, regardless of how many days post-op you are. Things to bring in: loose-fitting clothes. You'll be getting dressed each day. Toiletries, sensible footwear without laces, mobiles, phones and chargers, books, magazines, knitting, anything to occupy your mind.
The pain service is part of your care to ensure your stay is as comfortable as possible. It is inevitable that following joint surgery you will experience some pain. However, this needs to be managed to ensure you comply with your physiotherapy and to get you home as soon as possible. On the day of surgery, you will be seen by an anaesthetist before theatre. It is a good idea to make notes of anything you wish to ask them before you come in. Please bring in a list of your regular medication and let us know of any allergies or intolerances that you've tried before. Usually, there are two options of anaesthetics: a spinal or general. A spinal anaesthetic has many advantages, although it is not always suitable for everyone. Spinal anaesthetic is a local anaesthetic which is injected into your lower back, causing you to go numb from the waist down and enable surgery to be carried out. This can last for a few hours. You will also be given sedation if desired. Advantages of this include less sickness and drowsiness. You will also be able to get up sooner and can eat and drink on return to the ward. Any potential side effects can be well managed in the ward environment by the ward staff. General anaesthetics is where you are sent to sleep using medication. Advantages of this are that you are asleep and unaware of the procedure and pain at the time. Potential side effects can include vomiting and nausea. This can delay eating and drinking post-operatively, and you may feel sleepy for a while too, which may delay you in getting up. This may not be suitable for some patients due to medical history. Post-operatively, you will be prescribed a multimodal approach. You will be given medications which work differently and complement each other to control your pain. It will include a strong opiate, which is a slow release, given twice a day for 2 days following your surgery. You will also be given regular paracetamol and anti-inflammatory medications if you can take them. You will also be prescribed a fast-acting strong opiate, which you can ask for whenever required. We will monitor your pain regularly by asking you your pain scores throughout your stay. Physiotherapy can make pain worse, so please make sure you ask for painkillers if you are struggling with physio. It is beneficial to ask for this half an hour before therapy where possible. Pain is an individual experience, and we can tailor your pain relief as needed, and if you already take pain relief, this will need to be taken into account. If you are struggling, the pain service are able to review you. Pain control is not only about medication. Anxiety and boredom can increase pain. Distractions can help, so bring something in with you like to do.
The following exercises are to help you achieve the best outcomes following your hip replacement surgery. The therapy team will guide you through your exercises. However, it is vital that you practice these regularly throughout the day yourself. Lying on your back with your legs straight, pull your toes up towards you, then point them away, then repeat to briskly bend and straighten your ankles. Pull your toes up towards you and tighten your front thigh muscle, which is your quadriceps muscle. Push your knee down firmly against the bed to straighten it. Hold for 5 seconds, then relax. Repeat 5 to 10 times. Place your hands under your buttocks so that you can feel your muscles working. Squeeze your buttocks firmly together. Hold for 5 to 10 seconds, then relax. Repeat 5 to 10 times. Place a rolled up towel under your knee, being careful not to bend your hip past 90 degrees. Pull your toes up towards you and tighten your front thigh muscle. Push your knee against the towel, which will lift your heel from the bed. Hold your leg straight for 5 seconds, then slowly lower the heel back to the bed. Repeat 5 to 10 times. Pull your toes towards you and tighten your front thigh muscle. Keeping your legs straight and in contact with the bed, slide your leg out to the side as far as is comfortable, then slide your leg back to your starting position. Repeat 5 to 10 times. The next section will demonstrate how to safely use your elbow crutches. Bring your crutches together in front of you into a H shape. Place one hand on the crutches and the other hand beside you. Push up through your arms and good leg to stand. Once stood, place both arms into the crutches one at a time. Separate the crutches out to the side and slightly in front of you in order to stand safely and balanced. Ensure the handles of the crutches are pointing forwards. To sit back down, bring your crutches together in front of you. Take one arm out to hold the crutches in a H shape. Take your other arm out and reach back for where you are sitting. Slowly, with control, sit yourself down. As you lower yourself, slide your operated leg out in front of you for comfort. This is the first pattern of walking that you will be taught after your operation. Move the crutches in front of you, ensuring they are wide enough to allow you to pass between them. Step your operated leg forward to the line of the crutches, aiming to place your heel down first. Press down through the crutches with your arms to support your operated leg as you step the other leg to meet it. Do not step past the line of your crutches, as this may cause you to overbalance. Your mobility and walking pattern may be progressed by the therapy team as and when you are ready. Walk up as close to the bottom of the stairs as you can. Take your arm out of the crutch that is next to the banister and place this crutch in your other hand as shown. Using the banister and crutch for support, step up with your good leg, step your operated leg up and bring your crutch up onto the step where your feet are. Then repeat all the way up, one step at a time. Walk up to the edge of the top step. Take your arm out of the crutch that is next to the banister and place this crutch in your other hand as shown. Move the crutch onto the step below. Make sure that the hand on the banister is level with the hand in the crutch. Step your operated leg down to meet your crutch. Press through your arms to support your operated leg as you step your good leg down. Then repeat all the way down, one step at a time. Firstly, walk up as close to the step or curb as you can. Keep your crutches on the ground. Using your crutches for balance and support, step up with your good leg first. Then step your operated leg. Lastly, bring your crutches up onto the step where your feet are. Walk to the edge of the step or curb. Move both of your crutches onto the ground below. Step your operated leg to meet the crutches. Press through your arms to support your operated leg as you step your good leg down.
You will need to sleep only on your back for a minimum of 6 weeks or until your consultant states otherwise. If you find this uncomfortable or are afraid of turning while asleep, try putting a pillow between your legs or propping up with pillows. With your nose and toes in line, start to push up through your arms. Point your toes up to the ceiling and bring yourself round to the edge of the bed. Try to avoid twisting and crossing. Getting back on the bed, try to get your bottom near the pillow. Reach back with both hands and shuffle your bottom backwards up towards the pillows. Keep your nose and toes in line, point your toes up towards the ceiling and bring your legs onto the bed. To get dressed, you will need a grabber and a shoehorn. Remember those precautions. Do not bend, twist or cross your legs. Always get dressed when sat down. Dress your operated leg first and undress it last, as this will give you more material to play with whilst your operated leg does not move as much. Maintaining your 90-degree angle, hook your underwear through your grabber and drop them down to the floor. Pull up over your operated leg to your knees. Repeat with the unoperated leg. You will need to strip wash for the first 10 to 14 days. If you have a walk-in shower, you can use this once your wound has healed. It is recommended that you sit down when washing and dressing at all times. Do not use the bath due to the seated position it puts you in, with your knees above your hips. You will not be able to bend down to wash your feet or twist to wash your back. Long-handled sponge can help with this. To dry your feet, place a towel on the floor under your feet or use a flannel at the end of your grabber. Alternatively, if you have someone who can help with your washing, please ask them to do so. After the wound is healed, you might be able to shower, but this will depend on your individual showering facility at home. Please discuss with your occupational therapist. Undergoing total hip replacement surgery will impact on your personal relations. Pain, swelling and fatigue might prevent intimacy. You can resume sexual contact when you feel ready, both physically and mentally. Just remember those hip precautions. In the long term, avoid sexual positions which lead to bending your hip joint too far. Arrange help with shopping, cleaning and laundry. Stock up on easy-to-cook food. Cook meals ahead and freeze them. Rearrange the kitchen to avoid stretching, twisting and bending. You will need to use walking aids. so you won't be able to carry meals from one room to another. You may need to arrange to eat in the kitchen. Try to organise your kitchen so that things are in easy reach without bending or twisting. Bring essential objects down to the worktop and have them within reach. An apron with big pockets or a shoulder bag worn crossways are useful for carrying small items. Other things to consider within the home are good lighting, beware of rugs as they are a falls hazard, create adequate walking space for your crutches, remove any excess furniture or large items that may block the entrance into a room. Avoid clutter, beware of wet, slippery surfaces and make sure you use a light at night and your crutches if you're walking to the toilet. Returning to work during the 6-week hip precaution period will take a lot of planning and consideration. It will depend on the nature of your job type and role. For example, if your job requires you to sit at a desk, questions to consider would be, what type of chair will I be sat on? Will this be the recommended height for me? This can be discussed further during your phone call with the occupational therapist. If you require a sick note, please discuss with your consultant or nurse when you are on the ward. Getting out of the car on the passenger side, the driver parks the car away from the curb so that you're standing on the same level as the car. Have the seat pushed as far back as possible. Have the seat slightly reclined. To increase the height of the seat, you could try a cushion or a folded blanket. If it is difficult to manoeuvre on the seat, sitting on a plastic bag can help. Gently lower yourself down and remember to keep your operated leg straight out in front of you and do not twist. Slide back over the passenger seat until your bottom is well back. Use the driver's seat too if necessary. Swing both legs around together if possible and remember to keep your toes in line with your nose so you are not twisting. You may prefer to remove the bag before travelling to avoid sliding on the seat. To get out of the car, do the same procedure in reverse. Have a trial run of this technique before your operation so you are confident you can do it safely. You will be expected to go home in a car, so please organise a lift for the day you are discharged. If this is an issue, please discuss during your phone call appointment.
Thank you for watching. We hope you have found this informative. Please remember your occupational therapist will be calling you shortly for a one-to-one phone call.